Struby.
And I'm Wayne Struby.
And we're Therapy Nexus. Today we are going to be working on your deep neck flexor muscles.
Yeah. So posture. We're going to be helping you with your posture. We've put some videos out already about strengthening your scapula and helping with your neck. And we talked a lot about the deep neck flexors and having a good chin tuck.
Right.
Today we're going to really work on the chin tuck and show you how it's supposed to be done correctly. So because a lot of people tell them chin tuck and they're like really crushing it. You really don't want to fire these big bad boys up here because they make you do this. So we're working on the ones that are way deep inside, right in front of your cervical spine.
Called your deep neck flexors for a reason.
And they hold you from this to that. They kind of literally pull that together and help. You might even feel a little stretch back here because you've been here so long. Like this.
So you get tightness in the suboccipital muscles and then weakness right here.
Yep. People are doing this nowadays. They're doing this nowadays, and they're doing this nowadays, and they're doing this in front of the TV nowadays. So our ancestors, for however many 100,000 years they were here before us, were like this, carrying logs, watching out for bad guys, didn't sit like this.
Yeah, and there's a pattern, right? So when the head goes forward, the shoulders tend to go forward, and then the back curves.
Yeah, you get that rounded back
curves, and then you get tight hip flexors, tight hamstrings, and kind of all encompassing. So your core right here is supposed to hold, like, let's start with your head, right? Your deep neck flexor is supposed to hold your head up against gravity. Your shoulder blades muscles are supposed to hold you up even more, and then your core, and then what? You're in a good position now.
Yeah, and that's the thing. You really got to hit this up and hit this up, because if this is rounded like that, and you try to fix this and this is rounded, it ain't gonna work. So watch this video. I'll tag it right up here, and it's Hillary's course. The deep neck flexor and core stabilization. We'll stick them up there. So just click on that, and I'll put the link in the bottom too. But make sure you watch all this video as well.
Yeah. And these exercises are good for anyone that has headaches, neck pain. Anyone that's had cervical surgery to kind of just build up those muscles again. So this is very foundational, but it is the main movement for any other movement you want to incorporate. Right. So if you don't have this, then you're doing activities and you're not benefiting yourself at all.
You'll start getting impingement, start getting pain, feel like somebody has a freaking ice pick like right here. There's so many things that are going to happen and go wrong.
Oh, I hold my stress in my neck.
And then you go see a massage therapist paying $50 an hour, and then if everybody says, "Oh, I hold my stress in my neck," but even if they loosen that up, it's not going to fix you. Same thing with go see a chiro. They may manipulate. Some of them may teach you exercises, but they're not going to fix you. They'll make you feel better for a minute. So we got to teach you how to do this. So what all do we need to be able to do this stuff at home?
Okay.
Especially this specific one.
So today we are going to use
a blood pressure cuff.
Blood pressure cuff.
And
pretty
this
simple.
Is, I like to say it, it's a sphygmomanometer. So a sphygmomanometer is just a gauge. They sell these things that are like biofeedback pressure cuffs. It's the same thing, except this thing's a little bigger and you can see the numbers easier, but they're like $150, $60. You can get this thing for like $15 on Amazon. I'll put a link if you want to use our Amazon associate link on the thing. But just get a little blood pressure cuff. Yeah. You're going to pump it up, and Hillary has a protocol that she's given patients and helped many patients out with this. So we'll just share that protocol, so maybe it'll help you as well. And we're perfect, so we never have to use it ourselves, which we probably should. And then also you're going to need a pillow and a little piece of TheraBand. And TheraBand's super cheap.
Show the TheraBand.
So use a pillow. That's for holding the sphygmomanometer, and then TheraBand. Literally, you put this around your foot, and you're gonna be doing some exercises with it. And I can put a link for TheraBand if you can't find it on Amazon yourself. You can use our link; it'll help support us, because eventually I get like $10 after people spend $1 million. So all right. So what are we doing now?
All right. So the first one you're gonna do is you're gonna lay on your back in this blood pressure cuff. See how I have it nicely folded? It's gonna go right at the base of your skull. Right here at the base of the skull. So if you see, before I put this pillow up, I'm going to keep that back flat against the mat, so I'm not compensating with any of these movements.
Do an over exaggeration of a not flat back. You know, people like have this big arch where I can literally slide my hand under her back. You want to flatten it so she can tilt her tips that way. And now I can't get my hand under her back. So it's nice to have that. So you try to make your spine flat.
Yeah. So the pillow's here because if you don't have the pillow, then you're actually
You're kind of looking like that.
Yeah, you're having to compensate, and then your hands get tired. So this is just here to kind of prop your hands.
Hi.
Nice, close, and personal.
Let's see here now.
Okay, if you can see it, I've got the
sphygmomanometer. Well, I don't know if you can see it. Let me see if I can zoom in on it real quick. So show it to us again. Hillary, point it this way.
Yep, I'm getting it there.
Oh, I'll get around behind you then.
Okay.
So the sphygmomanometer, let me tap on it, zoom in on it. She tries to get it to 20. And then she nods her head, doing a deep neck flexor, and she's going to try to bring it up to what?
22.
You can barely see that. All right. Let me come back around to your head, and you're going to show them what the nod looks like.
It's very small.
Yeah, hang on a second. Now, go ahead and do the head nod. There you go, just a little thing like that. And so what she's doing, if you look here, zoom out a little bit. There you go, if you look here, so if you look right here, you'll see just a barely small motion of the chin, and she's pushing into that
Okay, you ready?
cuff. Go ahead. And undo and redo. So right there, you're giving yourself just a little double chin here. You should probably feel a little stretch back here in the back of your neck. Sometimes it's here, or sometimes it's right at the base of your skull. And she's kind of just sliding her neck this way, almost.
Like a J.
And so she's doing that while she's watching her sphygmomanometer.
And I'm holding it for 10 seconds. You can do this 10 times. You might say, oh man, that's just such an easy thing, but really,
it's hard to hold it there.
It's difficult.
2 millimeters of mercury is ridiculously hard to hold and keep stable.
Okay, so I'm at 20 now. We're going to go to the next exercise.
All right, hang on a second. I'm going to take this phone and I'll cut this out. And action.
Okay,
What's the next exercise?
I'm going to do a chin tuck
Mm-hmm.
to 22. I'm going to keep that chin tuck. I'm going to lift my head back to 20. It might not look like I'm doing anything, but I'm working really hard.
So you see this fire here? You also, that's fine. It's actually not activating that muscle. You're trying to make sure you don't activate
my sternocleidomastoid, that big muscle in your neck, you don't want to activate it.
So she said she's chin tucking, and then she tries to pick her head up just a smidge. And what she's doing is, so she chin tucks, which pushes this cuff down.
I'm gonna relax it again.
But I'm gonna explain. So when she does a chin tuck. It pushes this cuff down, and it makes that sphygmomanometer go up to 22. And then while she's chin tucked, she's gonna try to just barely pick her head up and bring it to 20. And that's tough, very tough. It takes a lot of control, and that's what this is all about. Your control and your precision and your ability to feel and perceive where your head is in space. Head weighs a whole lot of weight.
And this just gives you good biofeedback.
Yeah, it's biofeedback. So don't go buy a biofeedback one online for $150 when you get this for 10 times less.
Okay.
Now what, Hillsbury?
So now,
how many of those do you do? 10 times? 5-second hold? Or
for this one, you might want to start with 5-second holds and do it 10 times because it is tough.
Yeah. What's the next?
So the next one is you're gonna chin tuck to 20 to 22.
From 20 to 22, okay.
And then from here, you're gonna keep that chin tuck, and then you're going to rotate.
Okay, so you're rotating like you're trying to look over your shoulder.
Yep, but not too much.
Yeah, that's about as far as you want. You're trying to control it at 22 the entire time. Don't let the needle move. So you're teaching yourself little perception on where your head is when you're rotating your head and trying to keep that. Beautiful. What I used to tell my patients was a way to practice this. Once you're done with this, you can You're trying to hold your head up like that. So have that feeling again of where you are in space when you sit up. And I always told everybody you can practice this whenever you stop at a stop sign. Watch the road, of course.
Mm-hmm.
When you stop at a stoplight, you have that cushion on the back behind your head there. You can practice just holding your head up because a lot of people really start slouching when they're driving.
And when you rotate, you tend to lose that deep neck flexor, that chin tuck. So like when I chin tuck and I rotate, I lose it. And then that's why
That's what's so good about it. Yeah.
Yeah, it goes all over the place. So it's okay to go up and down a little bit because you're really trying to focus. But once you do this more and more, you will have it nailed down.
Okay. What's the next exercise?
Okay. The next one, we need the TheraBand.
Okay. So far you did the
chin tuck.
And that was
Hold 10 seconds, 10 times.
Okay.
You're going to do the chin tuck with lift. Hold 5 seconds, 10 times.
Okay.
And then you're going to do the chin tuck with rotation.
Okay. And
5 times each side.
And then
now we're going to do, oh, here it is.
TheraBand.
TheraBand.
Put it on her. Look at these special socks she's wearing. It says core strength. I don't know if you see strength on there. So she wore that today for everybody. And they're super beautiful yellow
and it's
socks.
cold outside and I'm wearing them.
Yeah. Can't stop that. All right. So now what she's going to do is she's going to try to strengthen some of her back muscles, the ones below her that we were talking about to help keep your scapula stabilized. And she's going to get that thing to 22.
No, I'm going to put it to 20.
I'm sorry. She's going to, then she'll chin tuck to 22. And then she's going to try to do a straight arm raise.
Yeah, we can move the pillow now.
You could even do a W if you wanted to. It's a little easier, ain't it? But just try to do a straight arm raise to do that. Hang on a sec. Let me toss this pillow out of the way. All right. And action.
Okay, so I chin tuck.
Chin tuck to 22.
Mm-hmm.
And then she's raising that arm up. Are you going all the way up to above your head?
Yep, that's the goal.
And down, nice and controlled because you're trying to hold it at 22 the whole time. And of course, if during any of these exercises you feel pain, don't do it. Don't push through pain because pain is an indicator that you shouldn't be doing it. Don't be like my old man, be like, I can do it. And then when she's doing this, I don't know if you saw that, but she set that shoulder blade down, trying to hold it back so she's not just, her shoulder blade doesn't just kind of wing up in the air. Looks tough.
This is tough because I'm not just like doing a chin tuck. Like I'm thinking about keeping my back flat against the mat. You see how my shoulders are around it. I don't want that. I want to like.
Yep, like I said, she set that shoulder blade
squeeze
down and
those
back.
shoulder blades together. I'm doing that chin tuck. So, and I'm keeping it at 22. And while I'm moving my arm, I'm like, oh, it's too many things. That's what the patients always tell us.
It's tough.
And you want me to breathe?
Yeah, man, don't forget about that. A lot of times, an easy way to remember to breathe is count out loud. Because you'll be like, 1, 2, 3, 4.
3, 4, 5, 6, 8, 9, 10.
See, she breathed.
Yeah, this is tough.
It is tough. And of course, like she said, that needle's going to be going everywhere, but you're trying to...
You can see I'm trying to correct it.
You're trying to learn that stabilization. That's what's so great about this. And eventually you'll get that stabilization.
Yeah.
And then we can progress to harder things, but that's later.
Yeah, this is, like I said, this is foundation because this is the start of everything. This is
look at that beautiful posture. Ooh.
Very unattractive.
That's what gives you that buffalo hump. You know what that...
Nobody likes that. And then you have...
Dowager's hump.
Old ladies or old men that end up being like this way, like because they haven't had to work hard for their posture. And gravity, if you don't work for it, gravity's going to win every time. So, in the beginning, you really have to focus on... Here, let's see this. Yeah. So, this is how we are. You need to focus on pulling yourself upright. I always tell patients, you want to pretend like there's a string going down your head, all the way down your spine, and it's just pulling you up. So if I'm here and I think about that string pulling me up, it puts everything that needs to engage.
Nice and flat there. Very nice.
All right, that looks good, right?
Mm-hmm. Now walk around like that all day. Keep it up. All right, cool. All right, this is coming from the power couple at Therapy Nexus. Thank y'all for watching.
Yep, see?
Share.
I had it correct.
Yep. Make sure y'all share this with people you think can use it. Okay.
And like it.
And like it.
See you later. Bye. Okay, this is the exercises we did. Deep neck flexor stabilization exercises. Okay, the first one, we did the chin tuck. We went from 20 millimeters of mercury to 22 millimeters of mercury. You hold it 10 seconds times 10. Second one, chin tuck with that lift, that really small lift. So you started at 20, chin tuck to 22, lift back to 20, keeping that chin tuck. Holding it 5 seconds times 10. Number 3, chin tuck with rotation. You go from 20 to 22, you hold it there, and you rotate slightly from each side, keeping it at 22. 4, chin tuck with shoulder flexion. We use a TheraBand. We use the red one.
You don't even have to use a TheraBand.
You don't have to use a TheraBand.
Especially if it's tough. So that's a progression.
Yeah, and you go from 20 to 22 millimeters of mercury 10 times on each side.
All
Okay?
Right. That was it. Once again, Therapy Nexus, power couple.
Check us out.
Hillary and Wayne. Keep following. We're going to post some more exercises for stabilization. Just keep tracking, and we'll keep posting them. Follow us on Facebook on our new group page. And we'll be posting on Instagram again and all that other good stuff. We'll try to be everywhere, but everything will be posted on YouTube as well.
Thanks.